So my favorite topic, marketing, of course. The most important thing I think that people realize is that most people, when they start to market their practice, they try one thing, and then they're kind of disappointed that they don't get the result that they're looking for. So my best advice is, find something and stick with it, but stick with it across multiple media. So take an idea, take a message that you want to get out there. So if you really want to do more implants in your practice and you're really proficient with implants, I probably wouldn't recommend marketing it unless you are. But if you really want to do more implants in your practice, so take a message, figure out what works with the message, and then take it across. Put it on Facebook, put it on radio, put it on TV, put it on put it on your website. Really, put a great thing on your website with it. Put do some direct mail with it, that kind of thing. Really go crazy with it. And if you're going to do that, if you're really looking for more than just volume and to really grow your practice with something like a niche like Invisalign or implants or sedation or sleep apnea, something that you're really excited about. Don't do it about something that you're kind of lukewarm about and you don't feel really passionate about. Do it with something that you're really into. That's something that we've learned, over a lot of trial and error, that if it's something that's really important to you and you're really excited about, you're really passionate about, then that's something you should market. But it's really tough to market something that you're only lukewarm about. So, getting the message out, through various different types of media and, a different offer for something, with something that you do, like a direct mailer with a really great offer, come in and, 2 implants for the price of 1 or something like that. That's just an option, or something I'm throwing out, but make sure that it's something that you really believe strongly in and that your team can really get on board with.
So one of the things that pops into my head is we do free Invisalign consultations, and those are across the board on, multiple different medias. Right. Like you said, it's on the website, it's on our, Valpak ad, it's on, a radio segment that, a patient does for us. Right. It's on our Facebook, Twitter. Absolutely. It's on all of those across the board.
Right. Well, and when we first started doing free Invisalign consults, it's really funny because, there wasn't the internet presence that there is now with it. So people can go and get a pretty hefty education about a procedure or, a service that they want in your office online. So they can get a ton of information about it. So, I find that I'm spending less time with patients when I'm doing consultations because one of the first questions I ask is, have you done a lot of research online about this? Do you know a lot about it? And people say, yeah, I've been looking at it for months online. Well, I don't need to give them, 30-minute spiel about what Invisalign is then. They have, do you have specific questions about that then? Because I don't want to sit there and tell them redundant information. They're going to get bored really quickly if they've already seen it, looked at it, researched it, and all that type of thing. We find that our patients are very well educated by the time they get in the door, which is fantastic. Then they know what they're looking for, they know what they want, and they come to our office, and if we're easy with them and give them free consultation and make it easy for them to kind of get into Invisalign, then that's an easy consultation.
So give me an example of a message.
Yeah. So a message would be something that portrays the dentist as an authentic human being. Somebody that, works in the community to do certain things, or just whatever you want your message to be. And the most important thing about a message would be features. Usually when you see a dental ad, a really typical dental ad, you'll see something that says, we offer root canals, crowns, bridges, partials, that type of thing. Patients don't want a partial, they want a replacement for missing teeth. So they don't want an implant, they want the, front tooth that's missing, they want a tooth there. They want a replacement for a missing tooth. They want straighter teeth, they don't want Invisalign. They want, so that's, they want a comfortable dental appointment. That's why they want sedation. They don't want to be sedated. They just don't want to remember the appointment. So make sure that you're very clear about the fact that don't sell the feature, don't sell the sedation, sell them the comfortable dental visit. Sell them the, explain to them how you can be the answer to the problem that they're having. So don't list a bunch of services that you provide, a bunch of features that you provide. What's the benefit to the patient? What's in it for them? When somebody's trying to sell sell you a car and you have a bunch of kids, which you don't, but you hopefully will someday, but you want safety. Yeah. And then, you know, I own the car that's known for the best safety record because I have kids in it. So, you know, you want to know what people are looking for, and that's the benefit to me. You know, my kids are safe, and that's why I buy that. But, you know, as a dentist, there's no difference in why people, you know, buy one thing versus another. They want straight teeth. There's, you know, several ways to get straight teeth. You can have a smile makeover, you can have braces, you can have Invisalign, you can have 6-month smiles. I mean, there's all sorts of different ways to get to the same thing. We just have to decide what's best for the patient. And clinically, of course, we know what that is, generally speaking. But that's the benefit to the patient. And a lot of times they'll come in, I don't really care what you do, and I'm not sure I care what it costs. I just want the benefit. I want the straight teeth. So, you know, give it to me as soon as possible. And so once we eliminate those barriers to getting somebody in, then that's when our message is very effective.
Okay, so give me an example of a message that we've used in our practice.
Well, we've actually built our practice largely on one message, which is comfortable dentistry. So the benefits of comfortable dentistry, of course, there are a lot of people that are afraid to go to the dentist. So this is a really simple thing. The benefits to them are pretty immeasurable, really. So we get patients in and we dip their hands in paraffin. We get the patient in, and you know, it's funny because a lot of dentists say, what does that have to do with dentistry? Well, it has to do with making the patient comfortable so they can actually enjoy getting services that we're providing for them. You know, we have back massagers on the chairs. We have warm aromatherapy neck wraps, and we bring the patients in and make them very comfortable. And then if they need, you know, if they need a little bit of, you know, anxiety medication, you know, we're not above giving that to them. We really just want to take care of the patient so they do feel very comfortable in our office, and that's actually been a huge practice builder for us. Yeah.
Great. Pointing at something.
Gotcha.
Good?